Hi, I'm Mary Colbert, and this is Dr. Colbert's podcast, Divine Health Podcast. And we are now going into the headaches part two, Don, because there's so much information on headaches.
And this information can actually give you a headache, So if we give you too much, we don't want to give you a
Yeah,
headache.
we don't want to give you a headache. Yeah, it is a lot of information. Listening to Dr. Colbert, I know sometimes is like taking a drink from a fire hydrant. But if you didn't get the information that helps you in the last podcast, you need to listen to this podcast because you're going to be covering there's so many causes to headaches and different kinds of headaches. So let's get right in so we can help them out.
Well, in review, we discussed on our last podcast on migraine headaches what a migraine headache is and what it feels like. You mainly feel that pounding, pulsating, throbbing pain on one side of your face, usually behind one eye. And it's throbbing, pounding, pulsating. It's just pounds.
And you can literally it can hurt so bad you're throwing up.
Oh, absolutely. You get
Causes them,
nausea,
yeah,
vomiting, they get light sensitivity. It's just all these crazy symptoms. But now tension's totally different. Tension headaches are the vast majority of headaches.
Okay.
A lot of my patients come in and say, I have horrible migraines. I check them. I say, well, does it throb? Does it pound? Does it pulsate? Is it behind one eye? No. Well, do you have nausea, vomiting, photophobia, light sensitivity? Does light hurt your eyes? No. Well, to describe it, well, it feels like a vice, like someone squeezing my head and my temples and my upper neck and around my head like a band being constricted. That's a tension headache. That's the vast majority of headaches. And these headaches are brought on mainly by just stress and tension, poor posture, and not casting your cares on the Lord, who cares for you, and watching too much news, bad news. Turn the news off. Watch funny movies, laugh. We got to relax these muscles. It's so simple, Mary. When a person has a tension headache, and I can see them when I walk in the room, I can tell because their shoulders are jacked up like this, where their shoulders almost touching their earlobes. And I'll look at them and I say, why are your shoulders like that? What do you mean, my shoulder? And so I feel their shoulders, it's like you've touched a brick wall. It's so hard. I say, these muscles are in spasm. I say, I see your main complaint's headache. I say, well, this is why. Or I touch their TMJ, their jaw's clenched, and they have this big old swollen hypertrophied masseter muscle. And so they're having to see their Botox doctor and get injections of Botox in their masseter or their jaw muscle to relax it. So they quit clenching their teeth or reduce it some. But they literally have to learn how to relax these muscles, how to de-stress. And so, again, that's the root cause of tension headache.
Well, does aspirin or Tylenol or any of that work?
Well, if you go to your primary care doctor, you're going to get aspirin or Motrin or Advil, which is ibuprofen, or Tylenol or Aleve, which is naproxen, or they're going to give you some other type of medicine that gets you addicted usually, or they'll send you for physical therapy, which sometimes helps. So again, anything that relaxes the muscles is the key. It's almost always those key things. The posture is poor, sagging posture. I call it the wilted flower posture, where your body's just sagging. It puts all that stress and pressure. The head's tilted forward, puts a lot of stress on those neck muscles, trapezius muscles, and then you're all tense. When your body's tense, just look at it this way. God designed us when we are tense. Blood is shunted away from our digestive tract to our muscles to enable us to fight or flee. So the muscles get tight. But what happens when these muscles are chronically stimulated, the blood flow to these muscles, the blood flow is constricted. So you get a buildup of lactic acid, of metabolic waste products, and hypoxia, or low oxygen. And then you start to get pain. Because due to low oxygen, those nerves start having pain signals going because they're not getting enough oxygen. All you have to do is relax the muscles, bring the shoulders down, just relax them with either some, hot water, massage, Epsom salt, hemp oil, CBD oil on that area, and the muscles relax, and then all of a sudden blood flows and the headaches vanish. It's the simplest thing, Mary, and then we teach them postural exercise. One of the key handouts I give to most everyone literally with tension headaches is postural exercise. We bring the posture back in balance. Those old muscles that are just sagging, we strengthen them. We pull the head back over the shoulders. God has created the most amazing scaffolding system of our body. We have 3 unique curves in our neck, upper back and lower back, which creates a scaffolding system that keeps us aligned and keeps the muscles from going into spasm and prevents headaches. But what happens as we age, our body goes into flexion. And these natural curves that we should maintain, we lose these curves. And when we lose the curves, it's like driving a car with the front end alignment out of alignment. You put more wear and tear on those tires, the tires wear out, and all of a sudden you get a blowout.
I know this shocks everybody. A medical doctor talking so much about, the frame, and it's so, and many times people misunderstand and think, "Oh, he's a chiropractor." No, he's not a chiropractor. He's a practicing medical physician. But it was funny, during your residency program, you did a whole rotation in chiropractic because you believe that part of a good, healthy body is structure as well. And it's part of answer. It's part of the answer. It's not the only answer. And I know a lot of people go see just chiropractors for just that reason and thinking that that'll make them healthy. But that is a part. It's
Oh,
not.
yes.
It's not the only part,
And
but it's
so,
part.
right, and stress is another huge part. People with tension headaches generally are not dealing with stress adequately. They don't know how to deal with stress. And posture is usually poor, as well as those muscles are usually real tight. So you got to address every one of those for tension headaches. But tension headaches, the symptoms are this, and this is how you'll know. The pain with a tension headache usually begins in the back of the head and the upper neck and is described usually as a band-like tightness or pressure, and it usually encircles the head. The most intense pressure is usually felt in the temples or over the eyebrows where the temporalis and frontal muscles are located. And the pain may vary in intensity, but it's usually not disabling, meaning they can continue to work and continue their daily activities. Whereas with a migraine, you can forget it. If it's severe, they have to be in bed in a dark room and not move and be totally quiet. But also, the pain is usually with a tension headache, both sides, whereas with migraines, just one side, usually behind an eye. The pain with the tension headaches not associated with an aura, no nausea, no vomiting, no sensitivity to light or sound. And the pain allows most people to function normally despite having a headache. And so, again, it's so easy to diagnose, and I see these every day in my practice. And like we said, the way most doctors treat is just with Tylenol, aspirin. That's where they say, doctors prescribe 2 aspirin or 2 Tylenol and call me in the morning. That's what they give you.
Now, Doc, can some of this quote tension headache be associated with being toxic?
Oh, well, yes, absolutely it can. We find that a lot of these patients, and when you do have this chronic tension in the muscles, you are accumulating lactic acid, metabolic waste tissue, and low oxygen in these areas, which are literally accumulation it becomes toxic waste dumps of the body. So that's why we've got to restore, we got to stop the spasm, restore oxygen to those tissues. That's why I have a special machine called a percussor. It literally relaxes those muscles, opens up those blood vessels, and allows that good oxygen and blood flow, which again will relieve most of the tension headaches, not necessarily migraines, but tension. Amazing how it works. And also teaching them how to stretch those muscles, bring them down, because many times the trapezius muscles are up, their shoulders are hiked up. You got to say, hey, bring those arms down, pull your arms down, teach them how to do that. Teach the spouse how to massage them or how to get one of these massagers that'll help them.
Okay, so does our liver detoxification help with?
Some people, it's amazing how, but migraines and tension headaches, there is a toxicity component. And when you do clean that liver out, we have these special natural herbs that help the liver with milk thistle and N-acetylcysteine and artichoke and selenium and and alpha-lipoic acid, which really helps support the liver. And some people, it's miraculous for both migraines and tension headaches due to the toxicity component. But the best thing for tension headaches that I find for the vast majority is simply hemp oil. Hemp oil, and you can either take it, droppers of it, or some people just rub it on the muscles and it relaxes them. And we also have a CBD oil mist you just spray on those muscles and it helps to relax the muscles. There is a strong trauma component to so many people with tension headaches, where literally the trauma is trapped in the muscles. And when I take these people through trauma therapy or forgiveness therapy, now unforgiveness will cause those muscles to contract. And literally anger and unforgiveness literally contracts those muscles where they literally can't relax. And so when I take people through either trauma resolution therapy and or forgiveness therapy, It is absolutely amazing how the muscles relax, the blood flow starts to flow in those once tightened muscles, and the headache literally vanishes immediately. I see this all the
You know,
time
I
with
remember
trauma
I
therapy.
remember there was one, young lady, I remember because I was in the room with you treating her. She had been in a hotel room, and a guy came into the hotel acting like he was pizza delivery and barged into her room and almost murdered
Oh,
her.
this was
Yeah.
like 2 years ago. This was
Yeah,
amazing.
he took a knife and was going to kill her, and she literally had these high heel boots on, which saved her life
She
because
kicked and kicked,
she
yeah.
used her legs and the boot to kick him and hit him, and she hurt him bad with those high heel boots, but
But it saved her life,
it
yeah.
saved her life, but, she started suffering from severe headaches, and when you took her through the, trauma therapy, it was amazing. She's like, we just saw her recently, and she is like, "I haven't had another headache since you took me through that," where she had to actually go through the trauma of it and release it. I mean, the man did get caught, he is in jail, and he is in prison now for doing what he did to her. But it was amazing how, when she was able to go full circle and release it and forgive him, that her headaches are gone, Don.
Oh, I
Gone.
know, amazing. Also, do you remember years ago, I treated one of Ted Bundy's near victims? She got away
Ah, I
from Ted
remember
Bundy,
that. Yes, I remember
and
that.
remember she had severe fibromyalgia, severe headaches, and things like that. We took her to the same thing. She was almost,
Right.
he
She
set
was
her up,
at the
University of
university.
Florida,
She was one
yeah,
of the students he stalked
or
out.
Florida State, excuse me,
Florida
Florida
State, he
State, yeah.
stalked her out and was trying to pick her up in the van. Yeah. And when she realized later what had happened and who he was and how close she came to being one of his victims, she literally had anxiety and fibromyalgia, and it just
Headaches,
became
all
a
of that.
train wreck,
Right,
literally,
but
from it.
that helped her tremendously.
Right.
Now, let me give you a simple solution for a lot of people. Peppermint oil, topical peppermint oil, 10% peppermint oil solution in a double blind placebo controlled study has been used for tension type headaches. And you apply this to the temples and across the forehead. And it is amazing how it helps so many people with tension headaches. Now, hemp oil will do the same for a lot of people, and or this CBD oil muscle mist. So those are simple things you can do that many times relaxes the muscles. If it's in your shoulder, some people just put the peppermint oil or muscle mist, CBD oil, or hemp oil there too. Other things that really help tension headaches, chiropractic therapy. And again, it's aligning, this is the structure, the structure, the structure. And when you have that muscle tension, that poor posture, it pulls everything out of alignment. The neck, the C1, the occiput, the cervical vertebra, the trapezius muscles go into spasm. So again, chiropractic using those instruments, which are 100 times faster than the human hand, are miraculous to patients. And we see that all the time. Most people don't need to see a chiropractor 3 times a week, once a week for a while, then once a month or once every 3 months. And it's usually all they need. If you have a chiropractor that just uses his hand, the hands are much slower and the ligaments can become lax where you need more frequent chiropractic adjustments. That's why we prefer the instrument trained chiropractors. But we find that those patients that have C1 out, and doctors miss this most all the time. When that's C1 out, it is like the master switch of the whole back. And it is so simple to diagnose it, and we get people to a C1 specialist or an orthospinologist. I have one that works with me closely in both my offices,
Mhm.
but we just have them, when we check them, I do this for every headache sufferer, and I'm amazed at how many people have this. And all they do is they bend their head down and touch their chin to their chest as they hold their arms straight out in front of them. And then if they go real weak when they bend their head down, that usually C1 is out or the occiput is out.
So they could have someone, press their 2 arms that are extended out, press the arms down with their
Before they flex their neck.
before they flex their neck and see that it's strong, and then when they bend their head downward to their chin to their chest with their arms extended and have the person in front of them lightly push their arms down, and if their arms go down,
Real weak. We know
real
that
weak, we
C1's
know
out.
it's okay.
And sometimes it's the occiput. Now, if it's the occiput, usually they're walking around with the head kind of tilted to one side.
Mhm.
That means the occiput's out of alignment, and that's where the cerebellum goes through there, and so they'll walk
Pinch
with a
it.
kind of head tilt.
Yeah, it
Right.
kinda pinches it, yeah.
And that has to be aligned. And then the cervical vertebrae need to be aligned because when those muscles are so tight in your neck and trapezius muscle, it pulls you out of alignment. And then
Mhm.
all of a sudden you're stuck and you have this neck pain and these headaches, and it's
Makes
just a
sense.
vicious cycle.
Yeah,
And it's
makes
so
sense.
easy to fix, Mary. It's just amazing how simple that is. And then we have them do these postural exercises where we pull their shoulders back, we pull their head back over their shoulders, and we strengthen these postural muscles, or else there'll be that bent flower look, that wilted flower. And then that pulls all your curves out of alignment. So your scapholine is damaged or it's impaired, so that you invite headaches back in. So it's so simple, and yet so many people miss it, but it's one of the easiest things. So the other thing is stress. Stress is the key
Mhm.
component for tension headaches.
Not
People,
just tension headaches, it's for a lot of things.
I
People
know,
are
but
under tremendous stress.
But Mary, stress is the key
I
thing for
know.
both migraines, I would say, and tension headaches. But migraines are less than 10% of headaches. Tension headaches are like 90% of headache causes or from tension headaches. But we find that stress is the key for tension headaches. People do not know how to cast not just some of their cares, but all of their cares on Jesus, who cares for you. That's the scripture. He tells us that he will keep us in perfect peace if, it's conditional, our minds are stayed on him because we trust in him.
That's the whole key, Don. You know what? It is so amazing to me how much of our health is really affected by what's going on between our 2 little ears. This pea brain of ours that, wants to get stuck on what ifs, the past issues, and it's amazing how we can just channel our thoughts, bring them into subjection, be in control of your thoughts. You can have a happy thought or you can have a sad thought. And I mean, like this week, I have to tell you, share with everyone. Marcus Lamb was a very close friend of ours, and you were very involved with his health and helping him through the years. And he was doing so amazing. But I gotta tell you, the loss of Marcus was a really tough time for you and I. It was a really, really
Oh,
tough time.
absolutely.
But,
Absolutely.
I remember waking up on the next day and the Holy Spirit really spoke to me and he said, "Mary, I want you to reframe this. He's with me, he's happy, and I want you to be happy for him. Don't be sad." And and all of a sudden I had to mentally take control of my thoughts, reframe it, and think through it, and all of a sudden, my sadness was gone. I wasn't sad anymore and I was happy. And it was all because of how I'm thinking. It's just in how we thinking. And we just have to really reframe our thoughts toward the Lord and give it to Him and suppress, these negative thoughts that the enemy is trying to get you trapped in. He wants you to think about the negative. God wants you to think about the positive.
Exactly right. But again, tell most people with tension headaches, I say, you have a poor caster. You're not casting all
Mhm,
your cares on the Lord who cares for you.
mhm.
But they say, but Dr. Colbert, I read the word every day. Every day I say my prayers at bedtime. I say, how long are you in the word? Well, I spend about 10 minutes, maybe 15 minutes. Well, how much time do you spend watching the news? 3 hours. As soon as I read the word, I spend 3 hours watching the news, and I go to work. I said, listen, you're getting 10 minutes of word, but you're getting 3 hours of unbelief. That's stress invoking. So we got to turn the news off because literally it's not that you don't have faith, you have too much unbelief from the news. So I have them listen to the good news. So that's one of the biggest
Mhm.
things I've found. The patients that listen to the news the most are the ones that have the most stress, the most tension. You say, but I want to be informed. Well, what I do is I just get my phone out. I get an app. I use Breitbart or sometimes Fox News. Just read the main stories, maybe 2 to 5 minutes max.
Or Tucker.
Or yeah, maybe
We
brief,
love Tucker.
right? And again, just small amounts, little tiny bits, and lots of faith, lots
Mhm,
of word, lots of
mhm.
Bible,
Yeah.
and lots of good teaching. Because if you focus on the negative, and the world, what's happening. We're in the last days. It's going to get a whole lot worse, folks. Wake up. We're
Mhm.
in the last days, but he's going to direct us by his Spirit on what to do in these last days. So we've got to start casting our cares on him because he cares for us. And he tells us in Philippians 4 to be anxious for nothing. Another translation says, don't worry about anything,
Fear not, fear not, fear not.
but he says, in all things through prayer and supplication with thanksgiving, again, thankfulness, let your requests be made known unto God. And then the peace of God that passes all understanding will keep your heart and your mind fixed on Christ Jesus. But it's conditional. We've got to enter into his rest. We've got to enter into his thanksgiving. We've got to make our requests known unto him with thanksgiving, and then the peace of God's coming, but not by listening to the bad news of the world. Listen, read the good news of the Word. I love to I have the Word on my app on my phone, and it plays. We listen to it all the time. You're on the treadmill listening to the Bible. I
Mhm.
love to listen to it, read it while it's playing.
Mhm.
And it has a New Living Translation. It has a New King James Version. It has the King James Version. So again, you get all kinds of insight from all these translations. But the big thing is people are carrying too much care. They have not learned to cast off their care, and as a result, they're getting tension headaches. And that's probably the greatest trigger I see. Now, you say, well, what can I do about it? Can I do something? Yes. One thing that's so simple that helps these tension headaches, and it's so cheap, it's amazing, is 5-HTP. It's called 5-hydroxytryptophan. This is a simple supplement amino acid, and studies have shown that it is wonderful for tension headaches. Now, the only caveat, if you're taking an antidepressant like Lexapro, Celexa, Zoloft, Paxil, what we call an SSRI, you shouldn't take this or it could raise your serotonin too high. But for all of you who are not on an antidepressant, or also if you're taking one of those SSNRIs or serotonin norepinephrine reuptake inhibitors like Cymbalta, Pristique, Effexor, you really shouldn't be on 5-HTP either because it could raise your serotonin too high. But here's what the 5-HTP does. It relaxes the muscles. A study in headache, the journal Headache, found that 65 patients with chronic headaches, tension headaches, were administered 5-HTP, just this real cheap amino acid, 100 milligrams 3 times a day, reduced the total days of headache, tension headaches by 37.5%.
You went through that so fast. 100
100
milligrams.
milligrams of 5-HTP 3 times a day
Okay.
reduced their headaches by 37%. And then when they went off of it, they still reduced their headaches. This was even greater, by over 50%, 55%, it said.
Wow.
So again, 5-HTP is dirt cheap. A lot of my patients with tension headaches, it helps them sleep. I'll put them on
Cool.
150 milligrams at night for women and 200 milligrams a night for men. Start there. And then we go up, and they may need a little more. Some men need up to 300 milligrams. Again, 300 milligrams is really good for tension headaches. Or you can take 100 milligrams of 5-HTP 3 times a day. Just some people get a little drowsy with that. So a lot of people do better taking it at night. But the 5-HTP and the hemp oil is your 1-2 punch for tension headaches, we find. There's other things we use like natural anti-inflammatories like curcumin and boswellia, which is frankincense. Amazing. Frankincense is absolutely amazing. And we give them in capsule form. Curcumin is 500 milligrams, 2 twice a day. Boswellia, AKBA or 5-loxin, 100 milligrams, 1 twice a day or 2 twice a day. Amazing for some headaches for some of my patients. And they just decrease inflammation. And it's a natural anti-inflammatory similar to Advil, ibuprofen, Aleve, but without the side effects. You don't get the gut problems. You don't get the kidney issues. It decreases, those meds can decrease blood flow to the kidneys. You don't get that with these natural meds. Such as boswellia or frankincense and curcumin. So I love those for headaches along with hemp oil or CBD oil mist or peppermint oil. But the easiest is just the 5-HTP. And then turning the Word on at night, turning the Bible on at night. Just read the New Living Translation, get that Bible app, and it'll read to you and put you right to sleep. And so it's one of the most amazing ways to just calm your body down. Take an Epsom salt bath at night. Amazing for tension headaches. Or get in a jacuzzi. Amazing for tension headaches. Don't forget to do your postural exercise. You say, where do I find these? I have an exercise book I wrote like 20 years ago, Mary, and we did the
That's
postural
right.
exercise. You'll
Yeah.
see Mary and I 20 years ago when we were,
Right.
we look almost, I'm the same weight as I was 20 years ago. You are too, which is
Right.
pretty amazing. Mary just lost, can I tell them?
No.
No, I can't say.
No.
Okay, excuse me. Okay, we'll leave that subject alone, but she lost a lot. She looks great. She
I'm
looks like
up
she
and
did.
down.
She
Up
looks
and
like
down.
she did 20 or
I'm a
30 years
yo-yo.
ago.
I'm a yo-yo.
But no,
I
not
go up and
anymore.
down. I know.
Not
No,
anymore. You're no longer a
I'm
yo-yo.
committed. I'm committed.
But the good news is tension headaches are easy, folks, to conquer. We do it every day. This is one of the most common things we see are headaches. In fact, most places tell us that the tension headaches are the most common symptoms we see in medical practice.
Well, be sure and go to our website, drcolbert.com, and take a look at our products that he has recommended. Some of these products we sell on our website, some we do not. You have to go to a health food store to get it. Be sure and share the podcast with your friends and family and let them know about this podcast. We're committed to try to bring you the most current, up to date information that is natural. If Don knows medicine is important, he prescribes medicine. We're not anti medicine, but we believe that God's best is to get to the root of the problem, find out why the body has become diseased, remove the thorn, and the body will heal. And so we believe in the natural. We believe God's natural answers are the best because you don't have a drug deficiency. You have many times just a natural deficiency that you need to address. And the scripture says, having done all, stand. Having done all. All is doing some of what Dr. Colbert is instructing you to do. And then you will walk in perfect divine health. And I believe that's the will of God. Don, it was so exciting this week. You had a patient come in who is 101 years old.
Amazing lady.
And I'm starting to
Amazing.
post on my Facebook. I'm videoing all the patients that are over 100 years old that have come to see you through the
Mary,
years.
I've
and
been
now,
seeing her for 20 years.
I know.
This lady's amazing.
I know.
Amazing.
And she's dancing with me in the office. So I put the video on my Facebook
But
page.
but you need to tell people they didn't know this. This 100-year-old lady goes to church every Sunday. She's the greeter at the front door, hugging everyone that comes in the door. And I say, wait a sec. Have you had your vaccine? No, I'm not taking vaccine. She's a little Spanish lady from Puerto Rico. Precious.
She doesn't walk with a cane. She's not in a wheelchair.
Good eyesight. Good
Good
memory.
eyesight. She's walking around. She was dancing on the video. It's so cute. She is so
But the
cute.
thing is, she's a church greeter. She
Yeah.
greets everyone that comes to her church and hugs everyone.
Yeah.
And she just loves
But
people.
she has no fear.
No
She is
fear.
fearless. She has no fear. And you know what? This is the way she is an example for us.
And
to
she has
walk
no
in
headache
perfect-
either.
No
I
headaches.
know, she's amazing. But real quick, number one, some people will do good with acupuncture with tension headaches. It's amazing how this is miraculous for some patients. Some people do amazing with massage. Some people do amazing with chiropractic therapy, especially with those instruments like the adjuster, ADJUSTOR. And we have the adjuster at my office. Some people do great with physical therapy. Some people do great with biofeedback. But most everyone can start with simple things, just a hot tub bath with Epsom salt at night, a little 5-HTP at night, maybe 200 milligrams, some hemp oil or CBD, and then maybe some muscle mist with CBD. Just a few little simple things and lots of water and stretching those muscles, bringing those muscles back in their natural position, and especially breaking that muscle spasm up so that the blood flow can flow normally. Now, real quick, before we finish, we want to talk about sinus headaches because I see these a lot, and that's another type of headaches. It's so easy to fix. If you have pain and pressure over your maxillary sinuses or your cheeks or right next to each side of the nose or right between your eyes, these are usually sinus headaches. They're pressure. And so what we have to do for that is, number one, remove the key food that invites it in. And you know what that food is, Mary?
Cheese.
Cheese and dairy, okay? Yogurt. You say, wait, I have yogurt. Well, that's dairy. It's the casein. The casein causes our body, the casein A1 to be specific, it causes our body to secrete more mucus, and it causes that thick mucus that clogs up the sinuses. And you say, wait, I have casein A2 milk. Well, even that can do it. So you got to cut the dairy out for a season, and then you can rotate it in, provided it doesn't cause the congestion. But number one, lay the dairy on the altar for a season. You say, I love it too much. Crucify your flesh, lay it on the altar. And if you want to get rid of these sinus headaches, number one, that's the first thing you do. Number two, there's a simple over-the-counter med called Mucinex that is amazing at loosening those secretions. It's guaifenesin or Mucinex extra strength, and you can take 600 milligrams one twice a day. It loosens those secretions so you'll get all this junk out. Then you go get this little instrument at Walgreens, and I don't have any ownership or ties to this, but it works amazing for my patients, and I've used it in the past with amazing results. It's called the Navage, Navage, and you just put these little salt and bicarb packets in there, and you put warm water in there. Now, I have my patients use silver biotic or active silver, not colloidal silver, but silver biotic, 1 to 2 tablespoons in that water, and that goes in the sinuses, and it'll kill that either the fungus or the bacteria or the viruses in there. It just kills them. And you do it at least once a day, and then you got to rinse that out, and then you just keep doing it every day. And then we'll use a little nasal cord over the counter, 2 sprays in each nostril, usually once a day. Now, if people have severe sinus infection, I have a special laser that's called an EVRL that shoots out 4 laser beams. 2 are purple wavelength and 2 are red wavelength. We put it right over the sinus being affected, either the maxillary, ethmoid, or frontal, for about 10 minutes a day, and it literally helps speed up the process. And that's how simple it is. And then drink lots of fluids, lots of water. Just avoid the dairy. The dairy is the worst culprit for sinus infections, and it is amazing how it does.
Which causes sinus headaches.
Absolutely. Now, the other thing we sometimes will do is we'll get them the silver biotic and a nose spray, have them lean their head off the bed and spray it up in their nose twice a day, or they can nebulize it through a nebulizer and inhale it through their nose. And it gets up in the sinuses and kills all that. But then you got to use the Mucinex or guaifenesin to thin the secretions to get it out. Or you can get these steamers, and there's these nasal steamers that literally cut the mucus out so it comes out. But the Navage is the key with that silver biotic, with the Mucinex or guaifenesin, the Nasacort nose spray, and then it's amazing how, and stopping the dairy.
Our sinus formula. Are you kidding me? Our sinus formula is the most incredible thing that has ever come out.
No
God,
doubt about
it has saved my life.
It has, absolutely. But that's the last thing we add to it is the sinus formula. You say, what is this
That should be the
sinus
first thing that adds to it.
Well, that's your nutrition that you need, because
Yeah.
what this does, it's all natural. It's got quercetin, it's got N-acetylcysteine, it's got vitamin C, and what this does, it helps shrink. It's a natural antihistamine.
Yes.
And it literally shrinks those nasal passages, and it strengthens the immune system, so the body just naturally starts to clear the infection.
So for people who have allergies and you've got like seasonal allergies, it causes your sinus infections and stuff. Folks, I am telling you, this is a miracle supplement.
Mary and I take it every day. I take 2 in the morning, 2 in the evening. It also has the quercetin that helps protect us against COVID, the vitamin C that protects us against COVID, and the most important thing is the new longevity study. These are people that live to be over 100. We'll tell you the key things they did that enabled them to live to be over 100.
Yes, you have got to listen to the podcast on living long and strong that the scripture says. And now I want to remind everybody, Dr. Colbert has a new book. It's out now. It's Beyond Keto. This is the lifestyle. This is the book you've been looking for to keep you in perfect health, to live. This is where you want to live.
Well, this is the diet to live to be over 100, preferably to 120, but it's the Mediterranean keto diet, or I call it the healthy keto diet, the healthiest Mediterranean keto.
And the ministers that we know that have read this book and, you know, you've been on TV, they are flipping out. They go, Dawn, this is your greatest book you've ever written. And I believe that too. It is very exciting. You want to get the book, Beyond Keto. You can pre-order it. Depending on when you listen to this podcast, it could be already out in print, or you can go to our website and order it. and you can be one of the first ones to get it. This is going to be the book that you want to live by for your healthy living. This is the book, man. It's so good. It's
Really
just
exciting, Mary.
good
Very
information.
exciting.
It's new information. I know people sit there and say, "Oh, Dr. Colbert's done so many books on diet." And yeah, yeah, yeah. This one is completely different. It is the best. The
Well,
best.
back in 2016, I wrote the book Keto Zone. And this is a healthy keto diet, but now we've gone to the next level. I've done the Mediterranean keto diet, which literally I believe this is the diet that enables us to live to be 120. I
Amen.
strongly believe that.
Thank you for listening. And you can replay this because we know it's a lot of information and hopefully this has helped you. Now, if you have a topic or something you want Dr. Colbert to address and you think, man, I wish you'd do a podcast on this, feel free to call our office. Let the girls know at the front desk that you have a request and we'll look at it and pray about it, and maybe we'll be addressing it just because you asked. So thank you for listening. God bless
God
you.
bless you. Until next time.